I'm Dr. Maria, in integrative medicine and anti-aging from Pasadena, California. With me today, I'm honored to have Dr. CYNTHIA Shelby-LANE. She's an emergency medicine specialist practicing integrative anti-aging and cannabis medicine. She is now serving as a scientific advisory committee for NCIA, stands for National Cannabis Industry Association. Today, we are going to talk about CBD, cannabidiol, in relation to your health, particularly gut and its microbiome. So, Dr. CYNTHIA.
Hello.
Hi.
Hi.
Could you please share your experience in the cannabis medicine field so people know who you are a little bit?
All right. Thank you, Dr. Maria. Dr. Maria and I are very good friends. So thank you for pushing me to this level. I appreciate it so much. I am practicing in Detroit, Michigan, and I'm an emergency physician by training. And I went on to practice anti-aging and alternative medicine, which piqued my interest in cannabis medicine. I know that California had medical marijuana since about 1996. And prior to that, I actually graduated from the University of Michigan Medical School, where when I graduated, cannabis was not to be discussed at all. So I really delved into this. It took a lot of courage for me to move forward, especially in the state of Michigan. And I started out in about 2010 or 11, and I was asked to be a cannabis physician. I had no clue what that meant. I just knew that it was legal in Michigan as of 2008. And it didn't work for me at that time, but I continued to pursue what CBD did, what THC did. I went to conferences, and as of 2014, I became a certifying physician for cannabis patients in the state of Michigan for those conditions that qualify for cannabis. So I'm interested in THC, CBD, and the endocannabinoid system. So it was just a curiosity that led me this direction, including everything else we did, you and I do alternative medicine wise.
Wow, you're very early then. Okay.
Yeah.
Can you share also with us, Dr. CYNTHIA, how CBD works in our body?
All right, so CBD is actually part of I'll go with it at it this way. You understand what your brain is, and your brain is part of the nervous system. That's a system. And your heart and blood vessels, that's part of the cardiovascular system. Then the gut is the GI system. So everybody's familiar with those words. But there's another system in our body. It's called the endocannabinoid system. And you're going to hear a lot more about that as time goes on. But it's called ECS, or endocannabinoid system. And this system is responsible. It's a mechanism in all of our bodies, whether you use cannabis or not, that provides homeostasis or balance. And so each system, let's say, for instance, the cardiovascular system is the heart. So it's sitting there on your chest wall, the lungs, the pulmonary system. But the endocannabinoid system is on every single cell in your body. So that's why cannabis and cannabinoids, we'll talk about that shortly, are so useful as we learn more science and research about what's happening to our body, what's making it stable, why our body works. And it's receptors on all the cells in our body. So it's everywhere.
Okay. So it works through that system. All right.
Yes.
Then, as an expert in cannabis medicine, Dr. CYNTHIA, tell us the difference between hemp-derived CBD and marijuana-derived CBD.
So when people hear the word cannabis or marijuana, they think probably one thing, but there is cannabis from THC, is cannabis sativa, comes from THC. It also comes from hemp. And so the CBD that comes from is called cannabidiol. So we're going to talk about it in those terms, cannabidiol. And that's what it's called, CBD, cannabidiol. Cannabidiol can come from the THC molecule, and it can also come from hemp. When you get it from hemp, it's usually a lesser quantity of THC. So think about THC in terms of being psychoactive and intoxicating. So then when people think about marijuana, like, oh, I'm going to get high, it's intoxicating. But the hemp plant has a smaller amount of THC, so it's psychoactive. That's why it helps with the mood and anxiety, but it's not intoxicating. So those are kind of the basic differences. A lesser quantity of THC in a hemp plant, and hemp is legal in the United States since 2018, and a greater quantity of THC. But the molecule has so many more components to it when you start studying cannabis and what it's doing in the body. So that's hemp, and some people need the full spectrum of CBD, and some people just need part of it. So that's how it helps to get you healthy and well. And I know there's a lot of people who are still against CBD. And I don't know if you talk to your patients about that, but some people are for it, some people aren't. You know, in Michigan, I had a lot of backlash in the beginning when I first started becoming a marijuana doctor. But I learned more, and I can take the heat now. This doesn't bother me anymore.
Okay, thank you. So, CBD is readily obtainable in most part of the United States. We know that, though its exact legal status is in flux. So, Dr. Cynthia, can you comment on the legality in the United States?
Okay, so for CBD, it is legal in all 50 states. And that's because as of 2018, the hemp bill was passed, and that made CBD from hemp legal in all 50 states. Now, some states are just starting to decide against that. And I always say that because it's very new information. I think in the state of Washington, they're banning CBD. I know the Navy has come up with some issues. Even though it's legal, some people are not allowing it. But it is legal in all 50 states based upon what the hemp bill did in 2018.
So when you say not allowing, means that they cannot obtain it over the counter.
So at this point in time, as of today, as while we're speaking, you can buy it over the counter. You can buy it at Whole Foods. You can buy it at the gas station. You can buy it through the internet, as long as it contains less than 0.3% THC. And that's what makes it legal to the hemp bill. But because the FDA, the Food and Drug Administration, is still coming up with how to classify cannabis/CBD, there are rules and regs that they're changing as we go on, and because they don't know if it's a food, or is it a nutritional, or what is it really? So we don't really know what category to put it in. We know it helps and heals, so that's why there's controversy all the time. But the Congress is just passing laws that will allow us to do more with CBD and more with THC in terms of research. So this just came out like 2 days ago. So this is incredible. I'm excited.
See, we're getting the innovative 2021 today.
That I get excited about because not only do I practice with patients and I do cannabis coaching, but I also have gone to Congress on 3 occasions, 3 years in a row. We didn't go this year because of COVID-19, but I get to talk to senators and congresspersons about cannabis, what it does from a medical physician point of view. I also go with business owners, but their slant is how to grow, how to cultivate, how to do testing. I go, how do I take care of my patients? Please help me take care of my patients.
Okay, so there is a system that you already mentioned a little bit about that stretch from the brain to our gut and also. So how the CBD hemp can help our gut or affect our microbiome?
All right. So there's another word that we never really learned in medical school. As a matter of fact, there's only cannabis medicine or cannabis as a plant has only been taught in medical school since 2013. So that's I graduated a long time ago. So I didn't learn about the endocannabinoid system. So new doctors are learning about that. The other system they haven't learned about is the microbiome. And as you and I know, as we go to conferences quite a bit, it's in the gut. Our whole bodies are made up of like 75 trillion cells, but in the gut alone, there are cells that are living there. It's a vast population of bacteria and fungus and protozoans. That's why people take probiotics. So this is called the microbiome. So everybody has a microbiome. So the endocannabinoid system communicates with the gut, which communicates with the brain, which communicates with all the cells in the body. It helps with healing with a thin lining in our gut so that if you eat something or something's going on in your gut, it has to be metabolized. The microbiome and the endocannabinoid system work together to help healing through that thin layer in the gut lining. So that's how it works. That's simple. And we could go on for hours talking about this, but I don't want to overwhelm people. So that's it. There's the endocannabinoid system and there's the microbiome. We never learned about that in medical school, but for the past 10 years, there's been quite a bit of research on that.
Oh, yes, yes. So does it mean that it's just a real quick question here? If you try to heal the gut, so it's best if you actually swallow them, so it goes to the GI tract instead of inhale or whatever. CBD is not inhaler, right? It's maybe on the
No, CBD can be inhaled,
hand.
tincture, so inhaled smoking, vaping, tincture, and you can combine it with THC, so that's under your tongue. There's topical, but that wouldn't probably work for the gut as much. Topical put in your skin, but so probably oral agents, tincture, and pills actually.
Thank you. Okay. So what is the time frame for seeing the effect or the result if you take the CBD?
So anything that's orally ingested will take so you take a pill or you use a tincture, and so it's something coming into your mouth oral system to see an effect that's going to be so remember CBD is not intoxicating, so you won't have that feeling like with THC where you feel high, but the actual effect, like with anything you eat, takes about 60 minutes for it to get active, and then it lasts in your body for about 6 to 8 hours depending upon your gut microbiome, your system, what's going on, and your endocannabinoid system. So everybody has one. It just varies from person to person, and it varies quite honestly with the dosing, micro dosing or administration of CBD. So how much did you take, and how did you take it? Well, yes, it can be inhaled. Yes, it can.
Okay. So, but how to tell if CBD dosage is a problem? Like too much or,
So that's called titration. So we always recommend, probably in medicine as well, just traditional medicine, go low, start low, and then titrate up, take more. And you'll be able to tell because you'll know what type of benefit you're looking for. So let's just say you have inflammatory bowel disease, or you have irritable bowel syndrome, and you have nausea, and you have diarrhea, and you have indigestion, you have constipation. You say, well, I'm going to take this to see if it will do CBD to see if it will reduce the inflammation going on in my gut. So you start maybe at what's classically known as usual dosing, 5 milligrams, 10 milligrams, 20 milligrams. So you start low and you go higher. You and I know both that, I don't know if you know, but I know for sure that we're not prescribing CBD. This is over the counter. So you're working with the patient, you're working with their system, and you're telling them, buy whatever you want to buy, look at the label, read the label, make sure there's no contaminants. That's really important. And I don't know how anybody really knows if they're contaminants or not, not unless the USDA does a recall. But considering that's not the case, you're going to go low and you're going to go up, and you're going to see what other medicines you're taking at the same time. You will titrate your own dose. And that's how cannabis is working nowadays. It's not a prescription based thing. So patients are not on their own, so to speak, but they're out there trying to figure it out. So you and I and other practitioners who are in the cannabis industry can help guide the patient and let them know which way to go. Like, do more, do less. Don't overdose. The biggest problem with overdosing is maybe nausea, more nausea, uh, but you just lower the dose and figure out what you're doing. Make sure you have no allergies. Also, that's really important.
so it's very personal and as
It
the
is, yeah.
tolerated, right? Yes.
Yes, and one thing that you and I can do is if and what this is what I do with patients that I'm certifying. I just say, let me bring your products in. So I really can't read a joint, I can't do anything like that. But with labeling, you can see what's in it. You can see percentage THC, CBD. You can also see terpene profiles. That's the aroma that comes with these products. So those are important things for as physicians and caregivers for patients to know so they won't get sicker.
Yeah. Thank you. We're talking about gut all the time, and I'm glad that we cover this specific CBD with the microbiome in the gut. So, Dr. Cynthia, what happens if uh, our gut microbiomes are depleted from the healthy bacteria?
Oh, so when the bacteria, the microbiome, it helps to digest our food. It helps to regulate our immune system. It helps to protect us against other bacteria that causes disease. So if you're depleted in a healthy gut microbiome, you may be taking medication, you may be taking traditional medicines that your doctors prescribe, and you're just not getting better because the bacteria and the gut microbiome are actually depleted. And it can it can worsen other ailments such as diabetes or even anxiety. You can see problems with obesity, even sleep deprivation, which I have a lot of, and our mental health. So it's important to understand that and take the right foods, nutrients, and CBD.
Yes, okay. So, Dr. Cynthia, does CBD hemp from hemp compete with any prescription medication?
That's a good question. I like that because people say nothing is really dangerous. You can't overdose. On the other hand, if you are taking medications from antibiotics to blood thinners like Coumadin and warfarin, if you're taking blood pressure pills like beta blockers, or even anti-anxiety medications, which is typically that's what it's used for, you may compete with the metabolism of the drug versus CBD because they're both metabolized through the liver, and it's called the cytochrome P450 system, but they both go through there. So one can slow down while the other speeds up. So your doctor should be aware that you are using CBD, the metabolism of properly prescribed medications may be altered, and the patient's results may be triggered in the wrong direction. So it's always important. I have to say this, that even though I see quite a few patients in a different industry than cannabis, and if you ask a patient about do they use any drugs, they'll shy away. They're afraid of us. They're afraid to say that they use cannabis. They're just afraid because they don't know you. They think you're judging them, and I'm not judging anybody. I'm just asking questions. But if you have a good relationship with your patient, caregiver, or whomever, but mostly doctors, because we haven't gotten it together yet quite with this industry. But if you ask them, you'll find out, and they'll understand why your treatment may or may not be working. So it's important to ask all those questions.
Correct, yes. So since CBD sounds like from your stories quite safe, but how often should someone take it again and again?
Okay, that again is like a dosing question or administration question. It really depends upon the person.
Does it have any like like the homeopathic? Usually, you stop after 8 weeks because it won't actually be too effective if you continue and stop for a week and then continue. How about CBD?
Well, I don't know that that's the case with CBD at this point. I don't have enough information to give you a good answer. It could be possible, but most people using CBD are using it every day. And if you get to a high level and you have symptoms such as, like I said, nausea, diarrhea, some of those other GI complaints, just back off and back down. And you could take a day off to give your own we have our own endogenous cannabinoid system. So you can take a rest and give your body a rest and see if it regenerates. So I'm going to ask my patients that question all the time from now on.
Correct. Do you get a lot of pain patient also besides like gut, the pain?
So the most number of people that come to see me are usually for chronic pain.
Mhm.
I see a few patients with and gut issues. I think that's the highest. And then mood disorders and PTSD. I see patients with seizures and multiple sclerosis and cancer. So those are some of the common patients that I take care of and coach and tell them what to do. So CBD versus CBD and THC. So THC plus CBD versus CBD alone are usually the questions, the line of questioning I get. Should I do this with THC? Will CBD alone help me? And then you go into the patient's history and you just try to figure it out. But you have to do a lot of reading into what they're taking, it takes a long time to just figure that out. So the patient's going to work with you. They're going to work with you. They're going to help you. You're going to help them. You're going to work back and forth. It's a mutual agreement. You must talk to the patient.
How often do they go back to you?
So for coaching, well, I have a coaching system now, which is really great. So I have an actual coach that helps me. So they see them maybe for an hour. They might see them once a month. And it depends upon what they really need. They don't always have to see me, but they need coaching. And some people don't want to see a coach. They just want to see me. So every 2 or 3 months, it's variable. And it depends upon their other problems also.
Okay, so before we depart, this is something that I have in mind all the time. Then people come and ask me this question. Maybe it's the same in your practice. People applying for jobs and they are in the competition doing sports, get tested for drugs. Are they going to be okay if they're taking CBD?
So that question is like what I call like the loaded question. Sports, your job, are you a pilot? Do you major transportation? All those things. And so I always ask patients before I certify them and as they're getting counseling, like, does your employer do pre-hire testing? Does your employer do accident or injury testing? Does your employer do random testing? If they do all three of those, you're probably at risk for possibly being fired because even CBD when tested, it depends upon the lab. They're going to do a urine test more than likely. If it's less than 3.3%, it probably won't show up. But on the other hand, it might because the labeling may have said, because they sold it. Remember, they sold it across state lines or on the internet. So if it was really tested not properly and it's more than 0.3%, your urine could come up positive for THC, not just CBD. And that's when the employer would take you to task. Now, the United States Navy just came out with maybe 2 days ago as well. All of this is coming out 2 days ago. And they will not allow anybody in the U.S. Navy to use CBD, whether it's lotions, skin products, anything, because they our Navy. Even so even though the government has said it's okay, the U.S. Navy said it's not because they want people on the front line in the military not to have any questionable problem with their duty. So their duty to act, their duty to perform in the military. So it's kind of odd, and I'm sure there's going to be some backlash to that because if the government said it's okay and you are the government, the U.S. Navy, then why are you saying we can't use it? And as you know, that many soldiers are coming back from overseas with PTSD, and those soldiers who are not in the military, not active, are there. And I forgot to mention that they need the benefit of THC and CBD. They just need it. So suicide rate is high, and we just want everybody to be taken care of. So those are concerns, and even in sports, I'm sure in sports it's going to be the same thing.
Yes. Okay. Thank you. Okay. So let me. There is another question. I hope you don't mind. So this is coming from outside. So they type this question. Please, what is tincture? They ask because you mentioned a little bit about tincture, and would this help with the leaky gut?
Okay, so tincture is a form of consumption. So marijuana can be consumed by inhaling or smoking. So that's called bud and flower. It can be consumed by edibles. It can, such as gummies and things of that nature, food products. It can be consumed by tincture, which is in a dropper. So it's a liquid, it's in a dropper. You put a little drop in, you put it under your tongue and in your mouth. That's tincture. It can also be used by topical, which is on your skin. So that's what tincture is when they mix it up and put it in that form. So people are familiar with using THC and CBD products by tincture, especially children. So the children in terms of seizures.
Mm-hmm. So let me see. Would this help with the leaky gut?
Yes, it will. Yes. But again, it depends on the quantity It depends on what your previous leaky gut problem was, but it reduces inflammation. That is the main purpose of what CBD and THC are doing. They're reducing inflammation. Leaky gut is like inflammation, and that's so one of the properties of CBD is to reduce inflammation. So yes, it would help, depending upon where you get it from and the dosing and how you dose it. Do you have to titrate up or do you go high? If you start high, you get sicker. So there's always what if.
Yes. Well, anything else you want to tell the audience?
Well, I'm happy that we're talking about this, and I hope that the audience is benefiting. Make sure you would talk to your doctor, tell your doctor the truth, let your doctor know what's going on. I think GI problems are huge, and taking traditional medicine helps, but we also know that there are some side effects to traditional medicines, like the proton pump inhibitors, and if people stay on them too long, and if they get the nutrient deficiency. So CBD comes into play by helping to balance that out, keeping homeostasis or balance.
Exactly. Yes. Well, thank you, Dr. Cynthia, for
Thank you.
sharing your knowledge. Very valuable, especially this is an innovative subject that people are still like grabbing here and there. So I know we need 2 full weeks to get this interesting all covered. Okay. Yes.
Right, right.
And Dr. Maria, Integrative Medicine, Pasadena, California. Please like us, share this link with your friends and relatives. See you again next week with more interesting subject. Same day, same time. Bye.
Bye-bye. Bye-bye. Thank you.